think I've already told you about the benefits of movement for the mind. There's tons and tons and tons of research studies looking at how exercise is beneficial for the body. Specifically, physical inactivity is like just a risk factor by itself to develop heart disease, diabetes, cancer, obesity, hypertension, bone problems like osteoporosis and depression. There was a study published out of Harvard that showed that physically inactive middle-aged women who engaged in like less than 1 hour exercise a week, they experienced like a 52% increase in all-cause mortality. Basically, it was like double those that counterparts who were actively engaged in physical activity, and their risk was only 29%. I mean, that's still high, but still theirs was way higher. So physical activity has been shown over and over again to counter some of those metabolic predispositions, especially for certain genetic groups like South Asians like myself. Exercise is extremely important in overcoming your risk of heart disease and the other metabolic diseases. So what exactly do I mean by movement? So the health benefits that you achieve, and like I told you before, yes, it'll be great if you can do 30 to 60 minutes, 5 days a week at least, of moderate intensity, or 15 to 30 minutes of high intensity. And what do I mean by that? It's basically like, if you're talking about moderate intensity, you're talking about power walking. So again, it's very subjective to that individual. So if all you've done is sitting on a couch, moderate intensity could be a power walk, and high intensity could be a jog. But if you're already a little bit more athletic, then high intensity will be a full-on sprint, right? So it depends on the individual, how much experience with sports or physical exercise they've already had. But either way, you need to start somewhere, and it doesn't really matter. You don't have to beat yourself up saying, oh my gosh, I barely get 2 minutes in a day. It doesn't matter. Start somewhere. A lot of people that keep saying, oh I don't have time, I'm so busy. Use the stairs at work. If you're always in the kitchen, find little like push-ups or jumping jacks you can do in your kitchen. It actually adds up, and all you have to do is be intentional and incorporate that in your day-to-day living. So if you are past the age of 35, there is something called sarcopenia, where you start losing your muscle mass. So performing muscle strengthening activities is also a very good idea as you age. And because you want to maintain some of your muscle activity, because that's what keeps you stable. And for people, once they cross 65 and they are more elderly, they need to be adding balance training to prevent fall. And that has to be done at least 3 times a week. For our younger people, the children and adolescents, at least 1 hour of moderate to vigorous physical exercises, minimum 3 days a week, if not more. And even for our children and adolescents, doing resistance training can strengthen their bones. So people who have diabetes, especially if you're on treatment, please first talk to your primary care physician or your endocrinologist before you go out there and do high intensity. I mean, this is important because you don't want to get hypoglycemic. But either way, all the providers, physicians who treat patients with diabetes, they promote physical activity. It'll be graded in a way to keep you safe. So whatever you do decide to do, definitely talk to your provider first. There's also evidence showing that dynamic resistance training for hypertension, as long as it's not very heavy loads, is also very beneficial. And for people with osteoarthritis, previously they used to be like, oh, don't move so much, but now people with osteoarthritis, it's highly recommended that the more resistance training they have, they can strengthen their bones.